Hey there, Tisha here, and welcome to the Hurdle to Hope show. Hopefully, you've had a lovely week. I've had another busy week. I was part of a panel discussion around lived experience within the disability sector, so that was really fun experience and met some incredible people. Today I'm actually doing this episode introduction from inside. So it's so windy outside. I thought you're not going to hear anything I say. So the background is of our full dam at Hurdle to Hope at Daisy Hill. If you're watching on YouTube, you'll see hopefully you don't get too seasick. We're going round and round in circles on loop, but this is our dam, which was up until just a couple of months ago, it was empty, so it's now full, which is very good for all the wildlife. And also you can see behind me, there's beautiful green grass there as well. So that's our dam. But I want to get on to today's episode. I'm talking all things diabetes. And you might be thinking, this doesn't sound a very exciting episode, but I promise you my guest, Therese Cameron, and I have lots of fun, lots of giggles. I really enjoyed this interview. And diabetes, it impacts all of us. You might either be living with it, you might be supporting someone who is living with it, or just trying to stay well and make sure you don't get diabetes. So diabetes is on the rise. Often it's very misunderstood. And in today's episode, we unpack everything with Therese Cameron. So Therese is a credentialed diabetes educator. She's a qualified nurse, chronic care coordinator, also a health and wellness coach, and the founder of Diabetes Alliance. So basically, Therese is the perfect person to chat all things diabetes with. What I loved as well is our conversation took us to places where I wasn't necessarily expecting it, but Therese is also a teacher of Qi Gong. She'll explain all about that, and also has had her own cancer journey. So what I love about these conversations is when we look at our wellness holistically, it impacts so many parts of our lives. So have a listen. You'll get a lot out of this, and I'll be back with another background video after this conversation. Enjoy. Welcome to the Hurdle to Hope show. I'm your host, Tisha Rose, and this podcast, it's about acknowledging that unexpected hurdles interrupt all of our lives, but it's how you respond that will define your experience. Each week, we'll be having real conversations with people whose lives have been interrupted and those who offer us support through our most challenging times. Each reminds us that even in the darkest moments, hope is always there. So welcome, Therese. Thank you so much for joining me here on the Hurdle to Hope show.
That's a pleasure.
We'll get into all that you're going to share with us today in relation to diabetes. That's what I've actually got you on the show for. We quickly met up in Sydney at a festival, and we were both, And when I noted down your name, and a festival, that sounds like it was a music festival. It was actually Australian Healthcare Week up in Sydney that I attended for Hurdle to Hope. And we had a chat, and I wrote your name down because I thought diabetes is such an issue for people now, whether we'll learn more, type 1 or type 2 diabetes. And it's something I don't know a lot about. So I thought if I don't know a lot about it, lots listening won't as well. But before we get into that, just give us a little bit of insight. Where are you joining us from today? And outside of work, what do you love to do?
I'm joining from Sydney, which is a beautiful sunny day here in winter at the moment, and it's just absolutely gorgeous today. What I like to do outside my sort of work time, as we just discussed before the show, I do things like Qi Gong. I like to go around the beach areas. I just love the water. And I also look after my daughter. She's got some disabilities, so I'm a carer for her.
Well, that's a full life.
Yeah, yeah.
And that's certainly, I'll get you back on to talk about that, because being in that role of carer does take up a lot of emotional space and actual physical time as well. Can you just give us a basic 101 to start with about what diabetes is and why it matters to all of us knowing, more about it?
So, yeah, there's two different types of diabetes, and there's a lot of confusion between the two. And then you've got a type that people don't know a lot about, which is mature onset type 1 diabetes. So, type 1 diabetes is really completely different to type 2. They're very different. Not only they're very different sort of entities, you might call them, but even some of the outcomes in research is different. So type 1 diabetics might be more prone to one thing, whereas type 2 to another, and they've gone right down the sort of like into the cellular level and shown different things. It's like, wow. So these scientists really get right into it and have a little look at why it's different. So for type 1, the average age of onset they used to say was 13. It's an autoimmune disease. And I don't like to use the word disease, I've trying to avoid that, but it's an autoimmune condition. And what appears to happen is that the body gets a virus, the body tries to attack the virus, but instead of attacking the virus, it attacks the beta cells in the pancreas and kills off the active beta cells. So, and that happens over, say, a 6-month period. Nobody's been able to isolate the virus. I know Greg Hunt gave New South Wales University a lot of money to try to isolate the virus and get a vaccine. But I said, when I told doctors, they burst out laughing, because how do you find somebody 6 months before they get a diagnosis to then isolate a virus? I mean, it wasn't going to happen.
Sense.
Yeah. And now you're sort of hearing things like, oh, well, it's not really a virus. Well, sorry, but we were taught that previously. I'm finding this, that a lot of that's, when I go to look it up now, it's like, well, where's that information? Because that's what we were taught. And there's actually antibodies that the doctors, the endocrinologists know that they can test for. And about 80% of the people with type 1 diabetes have those antibodies. And then you've got this whole other issue for mature onset type 1 diabetes. And I know of a brother of a doctor, and he was diagnosed with the type 1, and the brother was going, no, it can't be. But they looked at all the pathology and they could see that he'd had something called a glucose tolerance test every year. They could see all the results were normal, and they could see he was antibody positive for this particular virus. And he had developed really, really profound issues with his blood glucose that were not really not a type 2 diabetes type condition. So type 2 is really quite easy to manage. Type 1 can be more challenging, and that's where it gets sort of the bad reputation. If people with type 1 diabetes don't manage it, then they can have some significant problems. But it's the same with anyone. If you don't look after yourself, then you will get issues. So learning how to cheat the system is what I call it. It is fantastic. And I remember years ago meeting an athlete, and he had learned how to cheat the system. He was type 1 diabetic, and he was doing things that the doctors were saying, no, don't do that, that's terrible. But he'd go to the start line of the race, he'd bolus himself with an injection of 1 or 2 units of the insulin, and then he'd do his race. Well, now we've got these continuous glucose monitors or continuous glucose pumps and everything that do all of that, and they're taught how to do this. So what he was doing years ago, and initially was told, no, that's not something to do. Eventually the insulin companies had him design an actual website, and they had him doing lots of education internationally, and I can't remember the name of that actual website, unfortunately. But yeah, his advice came in very handy when they started to transition from what we call the basal bolus type of insulin doses to this whole insulin pump for the type 1 diabetics. So that was, it was really interesting. So listening to people and listening to what they say is so important. And the medical profession, we have a lot to learn from people.
Yeah, absolutely. And I think some of that, because a couple of things there in terms of what you do associate with diabetes one is in relation to injections.
Mm.
So, having that pump, how does that work? So they just regularly, do they still have to do their injections with the pump, or how does it work?
They shouldn't have to do their injections. No, they put the pump in. All the lines last hopefully for about 7 days, ideally. And
Yep.
the pump, they can put insulin into the actual pump and it pumps insulin into them on
Oh,
a
wow.
continuous basis. Yeah, it's
Wow. Okay, so it's
amazing.
inserted. That's
Yeah,
incredible. That's
yeah.
incredible. I imagine that would have a huge, huge impact of freeing people up of having to, yeah, all of a sudden stop for an injection. And I injected myself every day for 10 years. And I used to always think of people with diabetes having to do it a lot, and you run out of spots to do it.
Yeah, and the I remember a patient coming back. I'm so laughing, but she came
Yeah.
into the casualty and I went down to see her and say hello. And I taught her how to do the injections. And she was a type 2 diabetic on insulin because a lot of them end up on insulin. Anyhow, she had a whole lot of dots on her tummy because she was slightly allergic to the latex and they were all on the right side. I'm thinking, did I not teach her properly? Oh my gosh. So all the dots were exactly where she'd been injecting on the same spot, and which is what people
Oh,
do.
yeah, yeah.
Yeah.
It's where you
Mm.
can reach and where you can find. Yeah.
Yeah.
I get that. And so with type 1 diabetes, so if someone has that, what impact does that have on their life in terms of, I mean, you've got someone, which is amazing, doing running, but I'm assuming, yeah, are people thinking they can't do something like that, or yeah, what's the impact?
Type 1 diabetes is very profound impact. You can't have a holiday from type 1 diabetes. Type 2, you sort of can, but it would be great to support, and they're getting good support, people with type 1 diabetes, but it would be great that they had even better support, like retreats or somewhere where they could go where someone else could look after it for them. Literally, I mean, it's tough because there's no downtime. You can't go, today I'm not diabetic and I'm just going to do nothing, because that has bad ramifications. If you keep doing that for even 4 or 5 days, you can start to become what's called ketotic. If the levels go too high, you can get something called diabetic ketoacidosis and end up in hospital. And that does happen. So what happens there? I know of a teenager who ran away from home and went into hospital in far west New South Wales somewhere, and didn't tell them he was type 1 diabetic, and he had abdominal pains that they took out like appendix or something. They discharged him without knowing that he had type 1 diabetes. I can't believe it. Without picking up the type 1 diabetes. The abdominal pain was just a side effect of high sugars. So he didn't really get away. And if they do it for too long, unfortunately, blindness can be one of the side effects. And I even know of a doctor who nobody picked up that she had type 1 diabetes. Nobody thought she was a student doing medicine. And she had eyesight implications because it took them so long to figure out what was causing her illness. Losing weight, fatigued, and this type of thing. Sometimes it's not as easy. It should be easy to diagnose, um, but sometimes it does get missed. So it's profound because it can cause loss of limbs. It can unfortunately cause loss of vision. It affects people's lives in that I know of people who've gone for jobs, and as soon as they've said they're type 1 diabetic, no, no, they're not. No, they don't get the job. Difficult to get a job as a pilot. You wouldn't really, yeah.
Wow. Wow. I hadn't thought of that because it is such an invisible disease, really, to have an impact on career choices. Yeah, that's hard. And you're saying it's difficult to diagnose. So are there symptoms that someone could be aware of that, that could be an indicator?
Yeah, so one of them is the butterfly cheeks. So they'll have these sort of red cheeks. drinking lots of fluid. I know of one fellow who started drinking lemonade because he felt like he needed glucose, which was the worst thing he could have done, but he didn't know that. Weight loss is classic. So just sudden, profound weight loss. And then they can go into this diabetic ketoacidosis, which usually is when it is picked up, because that's one of the things they do check for in hospitals. They're mostly quite diligent, other than the fellow who had the appendix taken out. So yeah, so that there's some of the symptoms. So your butterfly cheeks, drinking a lot, weight loss, blurred vision is another classic one, your fatigue.
And hereditary in terms of, is there links often? Is there a family? Yeah.
The hereditary part, and this is then different from type 2 diabetes, the hereditary part is the autoimmune link. So if you're from a family that has a propensity to have autoimmune disorders, then that's felt to be the link, which then links back to this whole causative factor of more than likely they've looked at it being a virus and an autoimmune response.
Yeah. Okay. So then with type 2 diabetes, how does that differ from type 1?
The type 2, and why it's getting bigger and bigger, is because we're all getting bigger and bigger. So basically with type 2 diabetes, it's much more of a lifestyle issue. So they found out, for example, in Japan years ago, they did research, and just putting on one extra sort of centimeter, I think it was literally around the waist for the Japanese women, increased their risk of type 2 diabetes. So it's quite different. So from a clinical point of view, you've eaten your food, it's gone into the stomach, it's absorbed by the bloodstream, and the glucose is supposed to, or at least the insulin is supposed to get the glucose into the cells. But if there's a little bit too much fat, or you're not doing enough exercise, then you get something called insulin resistance, where the insulin isn't working properly. So that's quite different to type 1 diabetes, where they've got no insulin.
Okay.
Yeah. So some of the people with type 2 diabetes also have less insulin, so they'll have insulin insufficiency, and there's other causes as well.
Yeah. So I'm guessing then if it's a little bit environmental in terms of what we're doing to our bodies, the good news is, and the flip side of that is, I'm assuming then we can be proactive. So not to get a diagnosis, but then if we do get a diagnosis, then there's something we can do about that more.
Absolutely. So it's being mindful of the foods that you're eating. So certain foods will really go quickly and into the bloodstream and raise the sugar really quickly. So for example, short grain rice as opposed to long grain rice. There's something called the glycemic index, which they found here in Australia at Sydney University. So yeah, so when I first started as a diabetes educator, people would say to me, oh, if I have this bread, it doesn't shoot my sugar up, but if I have that, it does. And you sort of go, oh, that's weird, isn't it? Well, what they found at Sydney University was, and I think it was, the lady's name was Brand Miller, they found that some foods have got low glycemic index and some high. So your jasmine rice that we all love goes in almost as fast as glucose.
Wow. Okay.
Yeah. So it's a matter of making good, better, best choices, and then limiting the things that are too sugary. Like, for example, people I spoke to, if they have that sweet and sour, whatever that you buy, that can shoot their sugars up so fast.
Wow.
So you just don't choose those things.
Yeah. Yeah.
Most people still have that sort of sweet tooth thing, but maybe you'll have, if you get a cake, you might have half now, half later, or half, really space it out. And a good example of low glycemic index was in the United Kingdom. They didn't know about GI glycemic index, but the porridge, particularly the old-fashioned porridge, what they were finding, they said it cured diabetes for type 2 diabetes. Didn't quite understand at the time. But what happened was with porridge, it's absorbed so very slowly, not this 1 minute porridge, the old fashioned one, that it wasn't showing up as glucose in the urine. Because we only tested in the urine previously. So we tested looking at well, then we would put the person's urine into a test tube. We'd get us. I'm laughing. I can't believe we did this. We had a Bunsen burner in the treatment room, and then we'd put a tablet in, and if it was high glucose, I think it went green, or orange was the other color. I'd have to talk to my colleagues which color it went. You had to be careful not to boil it too hard so the urine didn't go over your fingers. With a Bunsen burner, trying to figure out if there was sugar in there. And I can remember diagnosing somebody with diabetes based on this Bunsen burner thing. And I've even recently, it's crazy. It wasn't long after that they invented some of the finger pricking testing and the dipsticks and things, but that's how we used to do it. So in the United Kingdom, they found that there was very low sort of transition into the urine, so they thought porridge cures diabetes.
But that's really interesting, and that's some of the things. And I'm smiling because each night I put like oats and all in a saucepan and put boiled water over it, and that's our breakfast next morning. Heat it up and put blueberries in it, and I'm very good. So that's a tick. But then Andrew likes those soft, really nice white rolls. So I'll be saying to him, yeah, that's high GI. I said, we'll stick to the porridge. Yeah, so that's interesting. But that's something we can all do to make sure, and lifestyle choices, because I think sometimes with these illnesses is when you feel out of control, like you can't have an impact on your experience with that.
Exactly. And what the insulin pumps have done for people with type 1 diabetes is give them enormous, like a control that they never really had before. And the pumps are getting smaller and smaller. We've got continuous glucose monitors as well. And they're still trying to do, I think some of them have got the maths where the continuous glucose monitor can talk to the meter and it like self gives the insulin. Like,
That's
the
amazing.
technology is changing literally in the last 2 or 3 years. It's changing so rapidly. That's been something they've been talking about for years, but it looks like they might have got it. The complicating factor is that most people think it's simple. In fact, you need somebody with a good understanding of maths to know, okay, that person's insulin requirements is this. They've got this level of what's called, let's say the insulin resistance or insulin needs, because their body, they're 6 foot and they weigh 120 kilos. And this person who's only 5 foot, it's a completely different mathematical equation. And you need to understand those equations and need to understand if the equation changes as well. So there's a lot of knowledge there that people need to have. And some people want to just put the pump on and take off. And we've had cases where people have arrived. I think a German girl arrived one time at St. Vincent's at Darlinghurst, and she had no idea. She in the casualty. Once they took the pump off, she didn't know anything about how to manage her diabetes. They had to ring back to Germany and go, what are we doing here?
Yeah, okay. And that sort of leads nicely into, because you've set up the Diabetes Alliance, and that's about education, is that right? What you're doing there? Yeah.
Yeah.
So tell us a little bit about your business.
Yeah, so for many, many years, what I have been doing is going into organisations and educating, so that the telehealth staff, or going to pharmacies and sort of raising awareness with diabetes. And there's been contracts that I've been having where I've gone into GP surgeries. I've now transitioned to the health coaching type area, because what's happening is there's not enough diabetes educators out there. And I probably need to educate you on what the different types are. So even when I had a placement at Royal Prince Alfred Hospital when they had a low staff, and I was still working part-time at my other hospital I was working at, and with the gestation diabetes, they would have like 60 people in a room. And I was shocked because in my clinics, we did one-on-ones with our gestation diabetes diabetic patient because we were a private hospital. And here in the public, the best hospital in Sydney is what I believe, certainly a very good hospital. They were doing massive, large group education. And the issue, your issue is that everybody's different. And the cultures, we've got so many different cultures as well. So if you talk to, and God bless the lovely Indian ladies, they come in and they have their dinner at like 10 o'clock at night. Because they work, they go home, they cook a full proper curry meal like mum used to. They eat late and the sugars are all over the place because they're not eating more like 6 o'clock. Yeah, so the group education is an issue. And then I've spoken to people, I believe that it's Dubbo. I don't think they have any diabetes nurse educators there at the hospitals anymore, which I'm really shocked. People think, oh, we've got a dietitian, it's okay. And I love the dietitians, and many of them are fully credentialed, but it's quite a different specialty to diabetes nurse educators, or podiatrists, so it would be good to sort of chat today about what the differences are.
Yeah, absolutely. I'll leave it to you in educators.
Yeah. So basically, if you go somewhere like, say, Royal Prince Alfred or some of the big hospitals for a diabetes clinic, that clinic often, when I was there, they had like 12 diabetes nurse educators and just one dietitian, and that was it. But that gives you the medical understanding of where the doctors place their needs, particularly with newly diagnosed people with diabetes. So with dietitians, that's more like, say, I wouldn't say a plumber, but it's a person that what food's going in, what it's maybe electrician, you might say. So they're the person that helps sort of fire up the body. And there are credentialed diabetes educators, dietitians. So let's just say they're in charge of the electricity system. You've got your podiatrists that are part of the team, and they're like the foundation people. They make sure that the feet are still there, because foot loss and limb loss used to be a big thing prior to the better education that we've got now. And then you've got the people that test the eyes, so the optometrists and ophthalmologists. And so they'd be like the people putting the windows on the houses, making sure you can see out, which is pretty important. So that's part of the team. For the endocrinologists, they're sort of, the whole sort of roof. They're like the brain of the system. They do the full what medications you need, and the GPs as well. Do you need this medication or that, or this insulin or that insulin? So they're like doing the overseeing. But for the diabetes nurse educator, it's more like the foreman or forewoman. So it's like the foreman of a construction site. So the person comes in and you say, okay, you need to see a podiatrist, you need to see a dietitian for sure, you need to see an exercise physiologist. So it's which is another specialty as well. So that the diabetes nurse educator goes through with all of those types of, which thing do you need to see, and you might want to see like an exercise physiologist, and then you need to assess, okay, well, that's fine. That's, what are your goals there? It's important to know what's appropriate. If somebody's really skinny and they're really, really fit, why would you send them to an exercise physiologist? If they're eating properly and know everything already, you don't need, so the diabetes nurse educator is like literally the foreman. So they look at everything. They have the knowledge and understanding, and because they're covered with APRA and because they're covered with the Poisons Act, they can actually a little bit adjust the insulins if they're credentialed diabetes educator to some extent, and implement the doctor's orders. They can start the insulin pumps legally, which the dietitians can't, or start insulin. So to me, it's more of a foreman type of position.
Yeah, that's really well explained. That's good. Because you're right. And if you don't have that, then someone goes, again, not putting down, like you've explained that perfectly, but someone goes to a dietitian, that's great. That's one part of it. But you've got the absolute overview. And that's the holistic approach, whether it's Yeah, whatever condition you have, to be able to have someone educate you on all the aspects of what you can do to manage that and keep well, like that's so important. And so with Diabetes Alliance, are you educating and chatting to like the dietitian or the medical practitioner, or is it also for individuals with diabetes?
Yeah, so with Diabetes Alliance, we're focusing at this point more on health coaching, so
Hmm.
which is completely different. So I was very lucky. At one point, I worked for Medibank Private, and I was working in a health coaching role as a health coach. So I would go into the GP surgeries, the patients would come in, and we would set goals for the patient as a health coach. They kindly gave me training on that as well. So, and there people come in and you want to set the goal that they can do more exercise, but they don't want that goal. So you need to work with the person and figure out, okay, well, what is your goal? Is there
Yeah.
this goal or that goal? How can we meet those goals to then get your outcome? And it was so liberating for the person because it's not my goal. I'm not a very big woman. Yeah, you did meet me. I'm
Yes.
very little, very bossy, a little bossy person. And
I wouldn't have
that
said that. You weren't bossing me.
I try not to be, but you, yeah, I'm the eldest of five girls, so so,
Okay.
yeah. And nurses in the past have been extremely dictatorial. It's how we're taught.
Yeah.
We were taught this whole thing of empowerment. I remember when it first started in the first conference we had in Canberra where somebody talked about this empowerment thing. And oh my God, how dare they? How dare people want to self-adjust their own insulin? And people were, and I remember, and I won't name her, I still remember she was lovely, and she's deceased. So what she was doing is she would get all of her patients to ring every morning to the hospital, and this was actually one of the big Sydney hospitals that they would ring, and she would help adjust their insulin every day. Well, you can't keep doing that. The numbers of patients are so huge. It's enormous. So when I first started, even at the hospital I was up at Sydney Inventors Hospital, we would have I got excited if we got 15 patients. By the time I left, there was like 3 times, 4 times that in the hospital every day. So you cannot be adjusting people's insulin for them. That's just,
No.
no, it's not practical. You have to do self-empowerment. And with self-empowerment and self-goals comes a much bigger ability then to manage your disease, I won't use that word, disease, any
Yes.
conditions that you have. Uh,
Yeah, absolutely. And then that enables you, if all of a sudden you can't be in contact with someone, you know what to do. And that's empowering. And it just makes you a bit freer too, to do things and not be scared.
yeah, yeah, like that athlete that was running around and self-bolusing before
Yeah.
races. He knew what to do before they ever invented these pump things with the basal bolus. He was doing all sorts of things in the background and not telling people. And I
Mhm.
found that was not unusual. And because I was a mum, and maybe I'm a little less bossy than I think, or open, people would tell me, "Oh, such and such a hospital, they told me that I have to." I'm laughing still. There was a nurse who had no children. Okay, God bless everybody, but she had no children, and she told all the mothers, "You have to give this particular insulin 30 minutes before the meal." Well, can you imagine? So what
Yeah.
you do is you give the insulin 30 minutes before the meal, and the kid sits there going, chocolate's looking good. I'm not eating. So what happened was we got a new insulin that you could give with the meal, but they're still teaching them no before the meal. Well, the kids are lovely, but they are naughty. And so what the parents were doing for this, and it was one of the biggest, I will not name it, it was one of the biggest hospitals in Sydney for children.
Yeah.
And all the mothers behind the back were telling one another,
Yeah, they knew it
they
wasn't going to
said,
happen.
even after the meal or after they've eaten, And I tried to tell the educator and she told me off. No, they're not doing that. I'm thinking, well, they are. Because I'm in the playground of a school listening to the woman you've got on your video as one of your main mums. So the reality is, if you give a kid insulin 30 minutes before they don't want to eat that meal, well, they're not going to, and then you have to give them some children so they don't go hypo, which they know.
So that's good. You're keeping it real, which is good because you've got to fit the environment, don't you?
Exactly.
As well. And actually, I'm just going to take it back just one step because I've actually got a friend who works with in now that we're talking about mums, it just triggered my thought with women who are pregnant who have diabetes. So that's the thing as well.
That's a thing as well. And with the youngest daughter that I had, I definitely had the gestational diabetes, and it certainly is a thing, and it's becoming more and more common because as the age group of women are getting older, plus if we're carrying more weight, you're much more likely. So gestational diabetes is quite common, and that was the education group where I was seeing they had like 60 women in one room. I mean, how did you educate? Any mother's going to be anxious. How do you educate a woman who may or may not be anxious because she's got gestational diabetes in a group of 60 people and make it individual for them?
And you're right, there could be an 18-year-old in that group and a 38-year-old, so it's all very different, I'm sure, their body and their response as well. So then once they've had their baby, is that then they've got then type 2 diabetes, or does it disappear, or what happens?
There's a 5-year transition where there's a high transition rate to getting type 2 diabetes.
Okay.
Some people say it's 50%, others say less. It can be quite a high transition. There are cases where it never goes away, but that is unusual. Normally, as soon as you have the baby, 99% of the time plus, the baby is delivered, diabetes is gone.
Yeah. Okay, that will keep her happy if she's listening, that I didn't forget what they're doing. So that's good. And what I also like, and when I was reading your information on LinkedIn, and I didn't know this, and I've written it down before because I didn't want to pronounce it incorrectly, but you also have an interest in and practice Qi Gong. Is it Qi Gong?
Yes,
Is that right?
I practice Sunshine Qigong, and I've run classes in the past. And if people would like me to come and run classes, I'm here in Sydney at any of their clinics or any place, I'm happy to do that. It's amazing. So what happened for me, and I noticed you also mentioned cancer. I was diagnosed with cancer, and I needed something that would distract me from that diagnosis, because it can be all encompassing when you go through that process. And so I started doing the Qigong, and it was just so liberating for me. And then a couple of weeks or so after doing it, I noticed this thing that they call Qi, and I just sort of noticed it accidentally. So what happened was I was outside, I had all the lights off. I was sitting on a seat, because you can do the one that I do either sitting or standing. So I was doing the sitting and just doing some of the Qigong movements. And what I thought was, busy doing the movements, and I thought that there were mosquitoes around because my fingers, there's some sort of tingling. I thought, oh, and put the lights on, looking around, there's nothing there. I'm thinking, oh my gosh, it's this Qi that they talk about. And it was so amazing. And then you're hooked, because then you understand there is Qi. Once you've begun to feel it, that it does exist, and you can feel the Qi energy. And from there, it was, I was living in the Chatswood region, so I was able to meet up with various people who are practitioners of the Qigong, and it's been very liberating. The people who practice it are just lovely. It helped to reduce the focus on the whole cancer thing. And also I've met doctors, and the doctor I did meet is now in Queensland, so I have not seen his research, but he was doing research on his particular type of Qi Gong, and they found it reduced blood glucose, because I suppose, yeah, it must have something to do with maybe relaxation or something, but doing the class once a week reduced HbA1c. So it doesn't just reduce your blood glucose like that.
That and porridge.
Oh, yeah, yeah, yeah. I had a man who came to me going, "Oh, I did yoga and it didn't work." It's like, please, no. You know, you've got to be so careful. And nothing here I'm saying today is medical advice, okay? Nothing. Because this guy did one session.
And he wasn't cured. He wasn't cured.
Exactly. And Qigong isn't going to, you eat a whole lot of cakes and then, oh, the Qigong didn't reduce my... So this doctor was looking at the 3 monthly averages. He was looking at HbA1c average, and he had a test group and another group up in Queensland University, I believe is up there now. So there's a lot of variables, including humans.
Yes, true. But I love that you're exploring other things. And that's what I always say, educate yourself about whatever condition you've been diagnosed with, surround yourself with a medical team that you feel connected with and use that. But if you're doing practices like that, you're going to connect, you're in a better headspace to connect to the right people and make the right choices in your life.
Exactly. Yeah, exactly. It was so... Yeah, it was lovely. And I'm still very much, it's 10 plus years down the track, and I'm still in constant contact with those people that I met at that time with the Qigong. And it was just nice to be focused on something completely different to the whole cancer business and all of that.
Yes, because that can get consuming.
Oh, yeah.
It's a whole new world, isn't it? I had no idea what that world was about until you're thrown into it.
Exactly. Yeah, this is not a fun world at all. And this took me out of there. I was able to go away for weekends. I've done like 7-day and 10-day retreats with it. And I must say, it's you just feel so much better after doing the retreats. And even somebody was behind me one time with one of the retreats we're at, and she said she was watching me throughout the day, and I have got a bit of scoliosis in the back for some old back injury, just good old nursing back injury. And she said she watched my spine straighten up during the day.
Wow.
Yeah, as we're doing the particular form that we were doing, that was assisting my spine to become straighter, which, yeah, wow.
Yeah, that's incredible. It does have an impact, and it doesn't matter. Lots of people, yeah. I mean, I just say have an open mind. Don't go through something to try and test it out after one session, whether all of a sudden your, PET scan comes out clear. But just have an open mind as to how that supports you through whatever you're going through. So that's really interesting. I'm going to look into it as well, because sitting down, that could be good for me because standing up and trying to balance and all I can't do MS wise.
Yeah, the sitting one was fantastic. Now I'm doing the standing one, but when I was going through all the treatments, I did the sitting one a lot.
Yeah.
And it still can be, very, very good to do that just slowly. And they call it like a form of meditation, because by the time you're so busy going like this, the body's not thinking, oh, my, whatever that thought is. It's too busy going, oh, we're not doing this right. But it can be you can actually empty your mind when you're doing these things. And Sun Shen, the particular form that I practice, is actually called unconditional love, which is beautiful. And our master Lee, I can send you some of the links. He's lovely.
Yeah,
but yes,
that'd be great.
And I'm happy to teach people and give people an introduction. If you're in Sydney, maybe I should start doing some of the ones on podcasts or something, teaching a little bit. Yeah, because it was, it's been so helpful for me, just to have that little extra thing, and then it inspires other people. And I find people have gone and taken on what I do and just run with it and doing all sorts of things, and it's inspiring then to realize that you've helped people to improve their own health
Yeah.
with just this simple practice. It's not difficult. And
Yeah.
it doesn't have to be hours a day. Like you can just do a little bit in the morning each time and just do some of the movements, and it really helps. And even apparently I saw something this week where you're lifting your arms up. Somehow that has a really big effect on the health that they've seen, which is like, oh,
Yeah.
yeah. So it's like, wow, I only saw that this week. I thought, what's that about? And how can that? Why would that even affect your health? Yeah, I was very surprised to see that, but I thought, oh, I suppose it makes sense, doesn't it? That might be why it's part of the whole Qi Gong thing, which
They're onto it. They're onto
yeah, which we
it.
know they've been doing for centuries.
Yeah,
And
that's right. And that's right. And that's what I think too is people not trying to not debunk myths, but when people haven't got an open mind and a bit critical of things, and as if putting your hands up above your head is going to have any sort of impact, how do we know? And if you feel it and it feels better for your body, that's what you've got to go with. And even for you, if someone said, yeah, you can feel the chi and you can feel the energy, and thinking, oh, that's ridiculous. But if you can actually think mosquitoes are biting your hand and you think, yeah, I can feel this, then that's what's happening. So, yeah, I just think that's really powerful. So thank you so much. We've chatted about a lot. I've learned a lot, but I'd really like finishing on that about us having an impact on whatever health condition there is. So, just quickly, what's ahead for you? You're mentioning your health coaching, which is great. So, how can people get in contact with you? We can put some links onto the show notes and on my website as well.
yeah, so I do have a website, diabetesalliance.net. So I've been updating that this week and hoping, yeah, to learn how to put in like all this technology to put in sort of booking tools. So to do it that way rather than through the phone calls for the health coaching that I'm doing, and it's goal setting. So it's similar to what I did at Medibank Private, which is slightly different to diabetes education. It's more goal setting, and you don't have to actually be diabetic for the goal setting. It can be more, the counseling, if that's what you're looking at, just what are your goals and where would you like to go
Yeah.
with those goals. Yeah, so just getting people to sort of helping people, not getting
That's
help.
right.
Yeah, and just figuring it out. And look, sometimes, say with pregnant women, it's really confronting to be diagnosed with this gestation diabetes. And I know what it was like. I went right through it, and I was very good at something called cheating. So we can set what goals would they
Yeah,
are they
absolutely.
looking at doing it? Is it around food, or is it around giving themselves more relaxation, or doing something more like this Qigong?
Lots you can do. So we'll definitely put that in. And yeah, thank you so much. I've really enjoyed our chat. This is the first time I've only just started knowing it's going to be on YouTube, and also I've done a few interviews, but this is the first one I've forgotten that it's recording, and I'm just like smiling and giggling along. So this is what we want. It's just that natural banter, and really getting to know different things that people have their lives interrupted with. And diabetes is 100% one of those. I know we all probably know someone. We're either worried that, a parent might have it, thinking we might get type 2 diabetes as well, but we can definitely have an impact environmentally as to whether that will be our reality. So thank you so much, Therese. I really appreciate it.
That's okay. Thank you for interviewing me today. Thank
You're
you.
welcome. Bye.
Bye.
Okay, so hopefully you enjoyed that episode and learnt a lot about diabetes. All of the contact details for Therese Cameron and Diabetes Alliance, they're in the show notes. For those of you looking on up in the sky, I just had a quick look. So the background is now of the clouds, and I look like I'm sitting on top of a paddock. So yeah, check it out on YouTube. And these videos, actually, I've just recorded the background ones for a new mini course. You can check that out, hurdle2hope.com/elements. And that mini course is about resetting your mindset in nature. So earlier in the intro, I talk about that was actually the water element. This is the air element. So I share how I use Daisy Heal and the 4 elements to heal. So we're talking about, and I'll get them right, we're talking about grounding through the earth element, then it's the air element, and then water element, and then fire. So many people, when I am doing some of these speaking engagements, are so envious, I guess, about me living on the land and living off the grid and how that's helped my healing. So as I'm doing with these introductions and YouTube with the Hurdle to Hope show, I'm bringing a little bit of Daisy Heal to you, so you can also see how I've used Daisy Heal in nature to reset my mindset and to really impact my healing with MS and with cancer. So enjoy your week. As I mentioned, go to the show notes for details from Therese. Otherwise, also go to hurdle2hope.com with hurdle to hope with the number 2/elements, and the mini course is free at the moment. Download it, connect, and learn a bit more about me and my world in Daisy Hill. Have a great week, and we will chat next week. Bye. Thank you for joining me on the Hurdle to Hope show. Please help me spread the word. Share this episode or others to friends, family members who you think will benefit from these conversations. Don't forget, we're also on YouTube now. At Hurdle to Hope is the channel. And if you need support, resources, or a speaker for an event, please visit hurdle2hope.com. Don't forget, Hurdle to Hope with the number 2. Enjoy your week, and if you're going through a difficult time, please remember, even in the darkest moments, hope is always there.